got my life together here. Good morning and good afternoon. It's been a long first day. Let us go ahead and begin. Thank you all for joining us here for the House Committee on Family, Children, and Seniors. Mr. Clerk, would you call the roll?
Chair Young,
Present.
Representative Scofia, Blandeville,
Present.
Arbit, Edwards,
Here.
McDonald,
Present.
Wozniak,
Here.
Fox,
Yep.
Johnson,
Here.
Thompson.
Here.
Madam Chair, you have 8 members present, a quorum.
Excellent. And so now I need a motion to approve the minutes from our June 18th meeting. Representative Glanville so moves. Very good. And so today we will be taking testimony. We will be taking up House Bill 5998 that will allow parents to easily execute documents needed to start a child custody case. With that, the committee will now go at ease at the call of the chair.
The Committee on Family, Children, and Seniors will now come back to order. Chair Young, thank you for bringing this legislation forward. And Representative Young is being joined today by Aaron Frisch, the Director of the Michigan Office of Child Support for DHHS. And you may take the floor.
Thank you, Madam Chair. Thank you, committee members as well. House Bill 5998 is simply a technical fix to simplify statements to aid parents in establishing child support. It amends the Uniform Child Custody Jurisdiction Enforcement Act to permit a verified instead of sworn statement as to a child's present address, places where the child has lived during the last 5 years, and the names and present addresses of the persons with whom the child has lived during that period. This change will allow parents and caregivers to more easily execute all documents needed to start a paternity and/or child support case remotely and electronically. Changing to a verified statement will make it consistent with other documents necessary for domestic relations cases and enhance child support services by not requiring in-person statements at a child support office, saving time and resources for parents, caregivers, and program staff. I am joined today by Aaron from DHHS for a more technical explanation of this legislation. Thank you so much for being here, Aaron.
Of course. Good afternoon. Thank you, Representative Young, for sponsoring this legislation. Good afternoon to the committee. The specific document that this legislation refers to is a document that states what the address and living arrangements are of a child, and a judge uses that form to determine if they have jurisdiction in the case to determine custody and parenting time and child support. Today, this is one of a series of documents that get filed, including the summons and complaint. Every other document does not require notarization. This is the only one that does. So this bill would remove the notarization requirement so that we may get those documents electronically signed, which will make the process much more accessible, much easier for a parent who is trying to do the right thing and get custody of their children arranged so that they can do things like enroll them in school, take them to get their health care, whatever that might be. And it's also much more effective and efficient for child support staff and court staff on the other side if we can be able to require an electronic signature. The document still says you're signing under the penalty of perjury if you're lying, so we do try to make it very clear that this is an appropriate and important thing you're signing to. And we have aligned this with Michigan Court Rule 1.109, which is the language that is used around determining what counts as a verified statement. Happy to take any questions folks might have.
Thank you both. Are there any questions? All right, seeing none, thank you for your time today, and the committee will now go at ease.
Thank you.
All right, we just have a few bills. A few cards. Sorry, a few cards. We have card in support, Sharday Burton and Aaron Frisk of MDHHS. Yes. No, it doesn't say. Aaron just spoke already. All right, we have a card in support, does not wish to speak, Kevin McKinney from the Court Association. We have a card in support, not wishing to speak, Stephanie Johnson, Family Law Section of Michigan. All right. Now I need a motion to report House Bill 598 with recommendation. Okay, Representative Glanville moves to support. Mr. Clerk, will you please call for the roll?
Chair Young,
Yes.
Representative Scofield,
Yes.
Glanville,
Yes.
Arvid,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Wozniak,
Yes.
Fox,
Yes.
Johnson,
Yes.
Thompson.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
All right, thank you. Next up, we'll be taking up House Bill 6025 that will bring the Guardianship Assistance Act in line with federal requirements for the new relative approval process. With that, the committee will now go at ease at the call of the chair.
The Committee on Families, Children, and Seniors will now come back to order. Chair Stephanie Young will be joined by Jessica Sweet, the Foster Care Adoption and Guardianship Division Director for DHHS. Feel free to get started whenever you're ready, Madam Chair.
Thank you, Madam Chair, and thank you, members of the committee. House Bill 6025 amends the Guardianship Assistance Act to modify eligibility for guardianship assistance payments to align with the new relative approval process, which expands assistance to relatives and those providing kinship care and still ensures child safety but does not require licensure. It further modifies the definition of relative to align with federal Title IV optional definitions that allow an organization to adopt licensing or approval standards for relative or kinship foster family homes. This will assist with more timely permanence and assist kin family members with receiving support without the extra layers and burdens that come with becoming a license for youth that is a part of their family. I am joined by Jessica Sweet today from MDHHS for more technical explanation and to provide any additional background information. Thank you for joining me.
Good afternoon. Members of the House Families, Children, and Seniors Committee. I'd first like to thank Chair Young for sponsoring this legislation on behalf of MDHHS and affording the opportunity for me to testify today before the committee. The Guardianship Assistance Program provides financial support to ensuring permanency for children who would otherwise remain in foster care until reaching the age of majority. Michigan law currently requires a guardian to be a licensed foster parent to receive guardianship assistance payments. This statutory change would modify program eligibility by allowing an approved relative to receive said payments. In 2024, Michigan led the way as the first state to receive Federal Children's Bureau approval to implement a new separate path for licensing relatives, known as relative approval. Previously, federal law mandated that relatives and unrelated caregivers meet identical licensing or approval standards to qualify for Title IV funding claims, without allowances for a differentiated process for relatives. One might imagine how challenging this could be for a grandparent who has taken in their grandchild and is in need of financial support, has to make changes to accommodate this new child into their household, and is also being asked to complete a sometimes arduous and lengthy licensing process. The federal rule change allowed for separate licensing approval requirements for relatives and aligned with Michigan's ongoing work towards a kin-first system and culture. In Michigan, we have been practicing the new model standards for years. We shifted our expectations and standards for kin several years ago to move away from licensing requirements and really focus on assessing for safety, providing financial support, and increasing the number of children placed with family. We modified our placement assessments to move away from non-safety licensing standards and allow for opportunities to apply critical thinking in placement decisions. We shifted our narrative away from requiring licensure. We have provided full financial support to relatives from the time of placement, which is not contingent on becoming licensed. And additionally, as a state, we updated our statutory definition of a relative to allow for fictive kin relationships to be included as relatives. All of these changes have led to an increase in the supports provided to kinship caregivers, as well as increasing the number of children placed with kin. This proposal would bring the state statute in line with federal requirements for the new relative approval process, which still ensures child safety but does not require licensure. This will assist with more timely permanence and assist kin family members with receiving support without the extra layers of burdens that come with becoming licensed for a youth that is part of their family. These changes allow for a relative caring for a child eligible for Title IV to receive assistance if meeting certain criteria. Circumstances and options are also detailed for a child who is not eligible for Title IV funds for possible state-funded guardianship assistance. This new change will expand access to subsidized guardianship and improve permanency outcomes for youth placed with unlicensed relatives by allowing the approved relative to receive guardianship assistance payments without going through the extra steps of requiring foster home licensure. Are there any questions?
Thank you both for your testimony, and thank you, Madam Chair, for bringing forward this bill. Colleagues, are there questions for the sponsor or our spokesperson, Ms. Sweet? Minority Voice Chair Wozniak.
Thank you, Madam Chair. Just a question on the, how would the outcome of an emotional relationship or a long-term relationship with the child be determined to put them in that position?
Sure, so our caseworkers assess that relationship through a variety of factors, including conversations with the youth, if they're old enough to understand that, conversations with the parent or other people who might have a connection to that youth, maybe grandparents, other people that might be involved in that youth's life, to really determine if there is that strong emotional attachment there.
Yeah, have you done that previously?
Have I personally done that?
Not you personally, as a department, done that previously?
Yes, the department has done that previously, and is our current practice in
Good.
assessing
All
for
right,
kin. Yeah.
thank you.
Other questions, colleagues? Representative Fox.
Yeah, thank you. Thank you very much for your testimony. And I play a game called Dutch Bingo a lot because I married a Dutch woman, and it's very common in West Michigan. And I find that within 3 questions, I usually can find a relationship with them, okay? And how are we going to avoid too quickly jumping to a 5th degree by blood, marriage, adoption, including the spouse of an individual? You know, I just worry that we may be jumping too quick and not trying to find those closer relationships. Thank you very much.
Sorry. Sure. So the connection by 5th degree has actually been a part of state statute for a very long time. We, as a department, order preference of placement with those who have the strongest emotional connection to the child. So if the child has a strong connection to a cousin or an aunt and a 5th degree relative comes forward by marriage for placement, the preference would be given to the person who actually has the connection to the child. The expanded definition, the expanded to 5th degree does help though in instances where maybe it's more challenging to find that closer connection for a child, and expands our ability to look for family members outside of the direct circle of the child in those instances. Thank you. You're welcome.
So I do have, I think, 1 or 2 questions about this bill package. And Rep. Young, I know you and I have had a lot of conversations about our informal kinship care families across our state. It's 50+ thousand, if I might be remembering the number incorrectly, but who, because of layers of bureaucracy up to now, have not been able to access the payments and the support as they are taking on children of, you know, their children or their niece, their nephew, what have you, and that has been very challenging for a lot of families who are taking in kids who are in a vulnerable situation and providing for them. So just to clarify, this would expand out and apply to them without requiring them to jump through the additional hoop of licensure. Is that correct?
This specifically only applies to children who are in our child welfare system. So children who are living with kin outside of our child welfare system would not, unfortunately, be able to access the guardianship assistance program.
Okay, so can you go back over then, because I think I'm misunderstanding the bill then, can you go back over then how this changes the current status quo for kids who are in the system, if you will?
Sure. So for children who are in the foster care system, if they're living with their relative or kin, that kinship provider has to go through the full licensing process in order to access guardianship assistance payments. This would allow for essentially what would be expedited permanency for those youth to get them out of the foster care system and with their relative in a more permanent way.
Okay, and follow-up question, can you just go into a little bit more detail about what this is making eligible to these families by going through this new process if this bill becomes law, the Title IV-E funding? What does that cover?
Sure. The Title IV-E funding covers a monthly stipend, which matches the amount of money they get for placement when that child is in foster care. They also are evaluated for access to medical subsidy that they might be able to continue once their foster care case is closed, like Medicaid and medical services.
Got it. Thank you so much. So great bills, and hoping we can continue to talk about how to fold in those informal kinship families who are going to still not have access to those funds. Thank you.
That's an excellent point. Thank you so much.
Thank you, Madam Chair. Seeing no further questions, the committee will now go at ease.
The committee will now come back to order. We have a couple of cards. Okay. Supports the bill, not wishing to speak, Megan Reynolds, a Michigan Poverty Law Program. Supports the bill, already spoke, is Jessica Sweet, but not wishing to speak, Sharday Burton, MDHHS. Okay. All right, so now I need a motion to report House Bill 6025 with recommendation. So moved by Representative Kofia. With that, Mr. Clerk?
Chair Young,
Yes.
Representative Sophia,
Yes.
Glanville,
Yes.
Arbit,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Wozniak,
Yes.
Fox,
I'm going to pass.
Johnson,
Yes.
Thompson.
Yes.
Madam Chair, you have 9 yeas, 0 nays, 1 pass. The motion prevails.
All right, thank you. Next, we'll be taking up a House Bill 6045 that will allow more than 3 smaller Michigan DHHS county offices to organize into a single administrative unit under one director for the purposes of administrative efficiency. The bill sponsor, Representative Christine Morse, will be joined by Sarah Demarius, the Senior Advisor and Economic Stability Operations and Operations and Programs for the Department of Health and Human Services. Ladies, the floor is yours.
Thank you, Madam Chair, Vice Chairs, members of the committee for the opportunity to talk about House Bill 6045 today. As you know, I am currently the chair for House Appropriations for the Department of Health and Human Services. So I am offering this bill today in the best interest of ensuring the department can act with utmost flexibility and efficiency in terms of our local DHHS offices. And so I offered this bill, which merely removes the number 3, limiting them to combining 3 counties, and giving them the flexibility to determine how many counties is appropriate for their operations to put together. It does require them to talk to the counties and make sure it's appropriate for all parties involved. But again, being such a large department and managing so many different offices, 83 obviously across the state, it's important for them to be able to act with as much flexibility and efficiency as possible. And with that, I will turn it over to our expert from MDHHS.
Thank you. Good afternoon, Chair Young and members of the committee. As mentioned, my name's Sarah Damaris. And I would like to thank Representative Moore for sponsoring House Bill 6045 on behalf of the department and affording me the opportunity to testify before you today. This bill would promote flexibility to balance the workload and resources across the local MDHHS offices, improving administrative efficiencies and flattening the county administrative structure and increase resource sharing. So these local DHHS offices are those that have the Economic Stability Administration, so public assistance programs determining eligibility for Medicaid and SNAP, and also child Children's Services Administration, so foster care and CPS in those. The bill will allow the department to consider the responsibility of each county director and provide the opportunity to balance their oversight more equitably. Considering operational needs to configure county administrative units would be more equitable for frontline support of our residents and more shared resources for our staff. Specifically, in the Economic Stability Administration, where the workload is primarily completed in a universal caseload model, aligning more first-line staff and managers to work together under one director will allow for more efficient management of the work and support of the first-line staff. The managers within the Economic Stability Administration are responsible for managing the universal caseload queues, in addition to supporting and training staff and ensuring that timeliness and accuracy measures are met. And so in smaller county configurations, those resources are limited. And so more resources under one county administration improves timeliness, accuracy, and employee satisfaction. The same can be said for the Children's Services Administration, where critical decision-making that impacts our families occur, and aligning more staff and managers under one administrative unit would provide greater opportunity for teaming and support to best serve our families. So for those who are not familiar, under the current legislation, some county administrative units, because they are limited to only be 3, are responsible for 1%, less than 1% of our workload and our staffing statewide. Over 50% of our county administrators are responsible for only 25% of all first-line staff and managers, and less than 25% of the workload between Economic Stability Administration and Children's Services. So just a quick example, in the Upper Peninsula, we have a 3-county configuration, and they have a total of 22 first-line staff and managers. In Wayne County, the Taylor District alone has 124 first-line staff and managers, and they only operate Economic Stability Administration programs there. So thank you for allowing me the opportunity to testify today, and I'm happy to answer any questions.
Representative Glanville.
Yeah, can you, I guess I don't quite, I'm not familiar with the system, let me be honest. How would this impact the folks seeking services? Would this mean that local or more regional offices would be closed? They would have to travel? I mean, can you talk about that a little bit?
We would still maintain a presence in the counties. What it would mean, in specifically speaking to those seeking assistance with economic assistance programs, there would be more resources within our universal caseload system. So there would still be a local office that's open, they can access MyBridges, but there would just be a larger group of staff in some of those smaller, what are currently smaller areas, in order to meet the needs and get the work done timely and accurately.
So you'd be adding staff to the scenario you just gave?
No,
of the
just
UP?
realigning. For
Okay.
example, the example I gave, the 3-county area in the Upper Peninsula only has 22 staff. So
How many do they need?
they may only need 22, but that limits time off, for example. If you only have 22 staff, you can only have so many staff out and still get the work done
Right.
at the holidays or for whatever reason. So if you have a larger group, it allows for more people the opportunity to take time off. It also provides the opportunity for managers, and this is pretty key for managers in universal caseload. They're managing queues, so the work that's coming in to make sure that it's being done, and then they also are managing their staff. And so this would allow for more managers in one group to be able to support staff and ensure the work is done.
Okay.
It's just a sharing of resources more so than anything.
All right, thank you.
Thank you, Madam Chair. It does make sense to eliminate redundant services. I think that's what we're trying to do. How many instances have 3 counties joined together, or 2?
We have several. I can get that information for you. I don't know off the top of my head.
Is it working with 3?
Yes. Some of our 3 counties and 2 county configurations are still very small.
And you're still required to meet with every county, or at least communicate with them?
Yes.
And do you see this going to a number that might be unmanageable administratively, like 5, 10 counties together?
At this point, we would need to, talk to the counties and evaluate. There is not a set number as to what that would look like.
Do you have a number in your mind?
At this time, no, I do not.
But-
There are 2 parts of the department, 2 administrations in each county office.
I
So
think
we-
at certain levels, this bill does make sense, but I don't want it to become unmanageable. Okay, thank you.
Right.
Representative Thompson.
Thank you. I think they rearranged us here. Now we got to try to figure out how to talk. So I still have many questions about this. My concern is being in Wayne County, and I'll just be honest with my concerns. I live in Wayne County. I live downriver. For example, because Monroe County is a little smaller, people that I feel that my constituents there get access to being able to speak directly to their caseworker. Their case seems to be run more smoothly. There's less hiccups, and then the people in downriver, they really struggle with getting access to speaking with their caseworker, follow-ups and emails, making sure that they weren't cut off by accident or that their papers are having that direct contact. So it sounds to me like this might be more of a pro-staffing for the department, but is that going to give better services and outcomes to the people that are seeking the assistance? That's what my concern is. Are you able to break that apart? And is this really meant to just take the burden off of the caseworkers so that they, have the time off they need and that they can organize their cases more effectively? But wouldn't it seem like they're going to be responsible for more cases, and then the people like downriver communities are going to suffer because, I even know now with the WIC department, people in the downriver community have to drive to Southwest Detroit. They used to be able to go to Taylor. Now, because they're combining, they have to make that drive, and I think that's what is very concerning for our constituents.
Understood. If we have more resources available to share, then, and less redundancy of maybe some of the extra positions, for example, in our smaller counties, we may have 3 different tri-county areas that and everyone has their own analyst or case reader or things like that. If you get into larger groups, then we could share the resources across those types of resources, which could eventually allow for resources to flow into other areas that don't have, that do have issues with service to residents. But there is a lot of work underway to try to realign to ensure that our organizational structure meets the needs of our residents. And this is one step of being able to shift resources across the state in order to do that in all areas.
Representative Kofia, and we're going to wrap up questions here.
Sure. Thank you, Madam Chair, and thank you, Morse, Chair Morse, and for your testimony as well. I didn't catch the first name, but so I have needed to deal with DHHS in various ways when I was a social worker with Head Start, and navigating through the layers of bureaucracy was challenging for me as a social worker, frankly. And so when I see removing a 3-county cap, and I represent rural districts, not as rural as the ones in the UP you mentioned, I'm immediately thinking about some of the concerns that I think my colleague was flagging around how much further are my people going to have to drive to get the services? How much longer is it going to take them? How much are they going to have caseworkers sort of bouncing around, and you get a different person every time and you have to bring the same pieces of paper in 16 times? These are real examples of what I've already experienced. Not looking to throw stones, but I am looking to reflect real world experiences that families who already have challenges around childcare, transportation, housing, food access, and all sorts of other issues. So I guess I have some anxiety about the idea of just removing the 3-county cap to no cap at all. And then I need a lot more clarity on the actual impact on vulnerable families who rely on these services. So anything you can do to be really specific about how this is actually going to make things better for those vulnerable constituents and families would help me tremendously, and why no cap at all?
As I mentioned earlier, we will maintain a physical presence in every county that we're currently in. So for the going to get your services, we will still be present there with workers or
The same worker each time, or bouncing around to different people every time you show up?
currently each county office determines how they staff their lobby. So I can't answer, in some it could be the same person every time, in other counties it could be a different person. This would, so in terms of accessing, they would still have that. It could provide more coverage on certain counties' phone queues, because right now they're by county, and staffing may be an issue with balancing all of the work on the phones. And we know that getting through on the phones is sometimes,
Yep.
related to work being behind. So aligning so that we can have the resources, the staffing resources in the areas that the work needs to be done more consistently and under one director is our goal.
So that will improve the experience of the constituents in what way, specifically? I heard more time off for staff, and I hear that, and that's fine, but what about the actual constituents needing the services? How will their experience be enhanced?
Because there'll be more consistency across county lines.
What does that mean?
If we are putting more counties together under one director, the operations will be more consistent. So
Again, I don't know what that means. What does more consistent mean? For whom?
for
And
the
in what
resident,
ways?
for the resident, they will be receiving the same, more residents will be receiving the same type of customer service, the same response time, because we can shift resources more so than we can right now in order to ensure that we have the resources where the need is the greatest.
Okay, so with that,
And nothing about the cap. So I would love some follow-up on this, and I need
Yeah.
a lot more specificity. Thank you.
yeah, so thank you both, excuse me, thank you both for your testimony. We're going to continue the conversation. So we will not be taking a vote on this legislation on today. We want to make certain that when everyone is prepared to vote with the information that they need. And so we had a few questions on today, and I respect that of my members. And so we're going to hold this vote hopefully until next week. So in that time, not next week, but when we come back. During that time, you'll have an opportunity to address these concerns and questions. Thank you all so much.
Thank you, Chair.
Thank you.
All right. All right, next, we're going to go back to something that was earlier on our docket. We're going to vote out House Bill 5781, previously introduced by Representative Sharon McDonald, that will give MiABLE beneficiaries more options for depositing and opening an account. We took testimony on this quite a few months ago, but hopefully you had an opportunity to review, and we're going to go ahead and call for the vote. Mr. Clerk. Oh, yeah, I'm sorry. I make a motion. I need a motion to report House Bill 5781. recommendation? Oh, okay. Representative Edwards. Mr. Clerk, we call for the vote.
On the motion to report, Chair Young,
Yes.
Representatives Copia,
Yes.
Glanville,
Yes.
Arvit,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Wozniak,
Yes.
Fox,
Yes.
Johnson,
Yes.
Thompson.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
All right, thank you, thank you. So with that, next we're going to take up a 5-bill package aimed at addressing a significant problem impacting so many of our young people, which is tobacco and nicotine addiction. These bills, collectively known as the Protect Michigan's Kids Bill package, includes House Bill 6002 through 6006 and 6022. I'm now going to invite all the bill sponsors, they're still here, to join me as we go ahead and give testimony on our bills. With that, we'll go at ease at the call of the chair.
The Committee on Families, Children, and Seniors will now come back to order, and we will now hear from bill sponsors, Representative Young and Representative Ayash. Go ahead whenever you're ready, please.
Thank you, Madam Chair, and thank you to the committee members. I come before you today to speak on a bill package that is designed to show just how much young Michiganders mean to us. It's a bill package that addresses a significant and stubborn health problem impacting so many of Michigan's kids and families. I'm talking about tobacco and nicotine addiction. My 2 sons never had an opportunity to meet their grandfather because at the age of 13, he started smoking cigarettes, and he passed away at 62 from lung cancer. And so this is something that is not unique, unfortunately. Many families have similar stories. It was in 1964 that the first U.S. Surgeon General report on smoking and health was a wake-up call and a galvanizing force. Subsequent scientific reports and revelations about the tobacco industry's tactics to hook new users and keep smokers addicted fueled action. We saw national education programs and organizing efforts result in meaningful policy changes, like smoke-free air policies and youth access laws. As a result, smoking rates declined across the country and here in the great state of Michigan. However, this progress did not last long. Approximately 10 years ago, the tobacco industry introduced e-cigarettes to the market. And by 2019, e-cigarettes had erased decades of progress in keeping young people off the addictive drug nicotine. In response to the spike in youth cases, Governor Whitmer took aggressive action to protect Michigan kids from the harmful effects of vaping. Specifically, she ordered the Michigan Department of Health and Human Services to issue emergency rules to prohibit the sale of flavored nicotine vaping products and ban misleading marketing of vaping products, including the use of terms like clean and safe and healthy that perpetrates beliefs that these products are harmless. She said in a press conference, as governor, my #1 priority is keeping our kids safe. And right now, companies selling vaping products are using candy flavors to hook children on nicotine and misleading claims to promote the belief that these products are safe. And she said that would end today. Unfortunately, it didn't end. Not even close, really. The emergency rules expire, and the legislature never took action to make any of the policies permanent. Today, our communities are flooded with cheap flavored tobacco products clearly aimed at youth. Yes, youth rates are starting to come down. We've heard that. They're starting to come down, but I would still argue not fast enough. Also concerning is that kids who are using more frequently. Nicotine dependence is setting in earlier, which is having a lasting effect on the brain and opens the door to future addictions and innumerable health consequences. The bottom line is when it comes to protecting kids and the communities from tobacco addiction, Michigan's policy landscape has not kept pace. Our state routinely earns failing grades from the American Lung Association and the Preventing Tobacco Addiction Foundation for policies that have been proven to prevent and reduce tobacco use and save lives. The bills we are hearing today are part of a comprehensive bill package that will improve and strengthen Michigan's tobacco prevention laws. While I'm the primary bill sponsor of 6004 and 6005, I strongly support the entire bill package and see all the bills working together to make the biggest impact. And so my bills in the package have to do with criminalizing young people who actually have possession and use tobacco products. I know when I first learned of that, I thought that was ridiculous. When you see children who will grow up in a household seeing their parents smoke or even an adult sibling smoke, of course you're thinking, there can't be anything wrong with this. They're doing it, why can't I? And that's just a natural assumption that some young people would make, but how dare we then criminalize them for doing something that they see adults doing? And so I was immediately drawn to this piece of legislation. And with that, I'm going to go ahead and turn it over to my colleague, Representative and the floor leader, Abraham Ayash.
Thank you, Representative Young, members of the committee, Madam Chair. I'm glad this conversation is happening in the public and not in smoke-filled rooms. And I think it's important because for too long we have looked at Michigan as an outlier in terms of how we are addressing the concerns around tobacco. We're one of 10 states in the entire country that does not have a tobacco licensure program. You need a license to tattoo people, you need a license to sell Christmas trees, you need a license to do someone's nails. You do not need a license to sell tobacco in the state of Michigan. So House Bill 6002 and 6003 would create a TRL program, a tobacco retail licensure program. And what it simply does is it creates a database and a system so that we can keep track of anybody that wants to go to the legal avenues of selling tobacco to adults. They have the right to do so, but it allows us to hone in on the bad actors. And I know we saw a story on the east side of Detroit earlier this year, just outside of my district, where a gentleman was selling unlicensed smoke products to an 8-year-old boy. And that type of behavior is unacceptable, but unfortunately, it is something that is pervasive all across the state, particularly in more of the poorer urban areas and the more isolated rural areas across Michigan. So with the TRL law, it allows us to be able to enforce laws and figure out who is selling and what they are selling at their stores. It creates a level playing field for law-abiding retailers by identifying and penalizing those who are not following the rules. It's a common sense policy. Like I said, if we require licenses for barbershops and nail salons and tattoo parlors and Christmas tree sellers, then I think we should, and liquor, then we should also have the same for an incredibly addictive product, which is tobacco or nicotine-based products. So we are still working with stakeholders, and we're having very productive discussions with our colleagues in the Senate, as well as LARA, the Licensing and Regulatory Affairs Agency, as well as the Cannabis Regulatory Agency, to figure out how we can make this program most effective. So we are continuing discussions with all kinds of tobacco retailers, be it gas stations, specific smoke shops, and anyone in between that is selling tobacco products. So the way it would work is you would pay an annual fee of $500 to be able to get a tobacco license, and you'd be able to sell that tobacco license, and then it goes through a program where you'd get penalized if you are selling to an underage Michigander. Now, the way it works is this. It's not folks that are doing the best faith effort to sell. If I walk in with a very convincing fake ID and I show you that ID and the employee then sells me the tobacco product or the nicotine or e-vape product, then I'm not going to be in trouble for that because I made a good faith effort to actually try and address this issue. This is more so to, again, figure out an opportunity for us to finally hone in these bad actors, because there is no doubt in my mind that the young kids that are smoking these vapes sometimes are going in with their older friends, and I know this from experience because I have nephews who are under the age of 18, and I have caught them in this act. So I can tell you that there are individuals who allow this type of behavior to happen because, unfortunately, for some of these retail workers, their interest is just to obtain the sale and not to be responsible in the actual process. So that's a quick summary of House Bills 6002 and 6003. Madam Chair, I know we have one final bill around local control. That's my favorite word this legislative term. And this legislation would, so Michigan has a trifecta, and we, like what happened last Tuesday, we are trying to break that trifecta here as it relates to tobacco. So local units of government do not have the ability in Michigan to tax, ban, or regulate tobacco or tobacco licensure in their respective municipalities. So we are one of the very few states that actually have that restriction across the board. This would open up the opportunity for local units of government to then figure out, can we do or should we do a special tobacco tax? Can we ban certain types of products in our communities? Or can we regulate it in a specific way that makes sense for our communities? That way we're not having a one-size-fits-all policy. If specific municipalities, say Detroit or Dundee, have different standards and different concerns, they should be able to obtain and have that ability to do so. So with that, Representative, I will pass it back to you, and maybe we have some experts, I think.
That's it. So, thank you so much, Representative, Mr. Floor Leader. We do have a number of experts in the room. We would like to give them the opportunity because we know that we are short on time. And with that, we'll leave it to you, Madam Chair.
Committee will go at ease at the call of the chair.
The committee will now come back to order. We will now, we're now going to hear from Jody Radke, the Keep Michigan Kids Tobacco Free Alliance Co-Chair and Regional Advocacy Director, and Paul Steiner with Tobacco Free Kids, if you all would come forward. All right. Thank you both for being here. Feel free to get started when you're ready.
I am the Regional Advocacy Director with the Campaign for Tobacco Free Kids, also as Chair Young mentioned, co-chair of the Keep Michigan Kids Tobacco Free Alliance, comprised of over 120 statewide organizations, and also a proud and native Michigander. Thank you, Chair Young and Committee, for allowing this public health issue to be discussed today, and specifically to the chairs for the shared priority to protect Michigan's kids from a lifetime of addiction to nicotine and set them up for lifetime into success. Also, just a special thanks to CRA and Laura. They have put an incredible amount of work into this bill, and I just want to express my thanks for that. As was mentioned, Michigan has a big tobacco problem. Michigan is one of 12 states that is referred to as is referred to as Tobacco Nation, which means rates in Michigan are 30% higher than other areas of the country. Cancer rates in Michigan, directly attributable to smoking, are nearly 32%. And we know exactly how we got here, and it's based on the weak laws that exist in Michigan. But the good news is we know how to reverse those trends. The bills here today are part of support these solutions. When we layer these policies, we know they have a synergistic and compounding effect when it comes to protecting public health. You heard Representative Mayash talk about the importance of tobacco retail licensure, 1 of 10, Michigan being 1 of 10 that currently doesn't do that. And outside of the obvious, why is it important that Michigan license its retailers, other than it being an evidence-based deterrent that keeps kids from using? Importantly, Michigan is out of compliance also with federal law by not doing so. In 1992, the Signer Amendment specifically requires states to enact and enforce laws prohibiting the sale of distribution of tobacco to persons at the time it was written to under 18. Of course, state and federal law now, that age requirement is 21. But more specifically, it has a very specific criteria that states must develop a strategy to reduce the rate of illegal sales to underage persons to 20% by the age of 2003. Well, obviously, we're in 2024. But that threshold is no greater than 20% failure. And it must conduct annual compliance checks of retailers selling tobacco both over the counter and from vending machines to ensure compliance with the law. That can be state or federal combined annual compliance checks. But again, that threshold, the importance there is 20%. Currently, Michigan's rate of sales, illegal sales to kids is 27%. To put that number into context, about 10 years ago, that national average was 9.5%. The lowest being Nevada and Minnesota at 1% sales to kids. The highest in the country at that time was the state of Oregon, also at the time unlicensed. Now they've passed state licensure law with a retail license annual fee of $1,000. They were at 22.5% 10 years ago. Michigan is 27%. That number should be staggering in and of itself, but when we take a snapshot of what does that really look like across the state and in your districts, in Detroit we know 60% of retailers sell directly to kids. Traverse City, that number is 30%. Shelby Township, 46% this year, failure, direct sales to kids. East Point, 56% direct sales to kids. And looking backwards of those federal compliance checks, we know there are a handful of retailers in September, October, and December in 2021 who directly sold to kids who have not been rechecked since. So for 3 years, we have no idea if these stores have continued to sell to our kids or if they are now in compliance. And we have a number of repeat offenders when you go through and look at the federal compliance rates and checks. And I hope that alarms you as much as it alarms me. This policy puts Michigan in compliance with federal requirements and federal law. And it demonstrates that Michigan does indeed have a plan to make sure that retailers are not illegally selling tobacco products to those who are not of age. But importantly, it removes the criminal penalties on our kids, and it shifts the responsibility to the adults who are profiting from the privilege of selling an age-restricted product in the state of Michigan. We thank you for your time today and your attention to this important public health priority. We encourage you to act without delay. Our kids cannot wait, and they are definitely counting on us. Thank you so much.
Submitted written comments, so I'll just leave it at that. But thank you so much for considering these bills. They really are putting evidence-based practices into policy and revoking some bad policies that were passed under sort of war-story conditions. So thank you so much, and happy to answer your questions.
Thank you both for your testimony. Do we have questions, members? Okay. Representative Glanville.
I understand it's $500 for the license. Is there any additional cost to retailers?
No, there's just the annual license fee and then a renewal fee. And then if they, of course, get caught selling, then they enter into a fine schedule.
Oh, thank you.
Okay, Representative Fox.
Oops, sorry, yeah. So I spent a few years as a missionary in the Philippines, and during that time period was when America was moving toward breastfeeding, and at the same time seemed to be encouraging infant formula in places like the Philippines. And also during that time period was when America was cutting back on cigarettes and going through their various policies and various lawsuits. But the strength of the cigarettes in the Philippines seemed to increase at that time. So I hear that China has is not allowing these type of products in their own country, but they're being shipped to our country. So my question is, how much are our retailers aware of this? Are there lists out there? Are there limits on what we should be selling? Are these firecracker stands that are going on? I just would like to know more about how are we allowing this stuff here in the first place? We're having other countries dump their garbage in our kids. So thank you very much.
Representative, it's a great question. When it comes to the world of vaping, it's important to note that the retailers are aware, the distributors and manufacturers in this country are aware, and currently to date, there are only 34 vaping products that are authorized for sale in the United States that have received authorization from the FDA. All other products that are currently on the market in the state of Michigan are being sold illegally. That's a really important distinction. So all these flavored, colorful products that you see in the store, whether it be Family Dollar or a vape store or a convenience store, are all being done so illegally. And again, there's only 34 that have been.
Right, so if there are 34 that are authorized, then how many unauthorized are floating around? Do you even have a number?
I mean, it's estimated thousands, and there was a congressional hearing about 2 months ago hosted by Senator Durbin asking the FDA why these laws aren't being enforced. And quite frankly, and admittedly, it's due to the lack of bandwidth and capacity at the federal level, which makes these statewide policies even more critical in terms of being the safety net for our kids.
Thank you. Representative Wozniak.
Thank you, Madam Chair. There's a sign that's supposed to be posted at each tobacco establishment. Is that true? Yes. And it says that if you're a minor, you're going to be subject to criminal penalties?
That's correct.
And the current bills will have that in their criminal penalties?
It would repeal, so the two repeals part of the bill package would repeal local preemption, so allowing cities and counties to pass laws, and then of course repealing PUP, which is purchase, use, and possession, for criminal penalties that are applied to our youth. Yes, that's correct.
Okay, and is there going to be any penalty on a minor at that point?
No, the criminal penalties that are currently associated in Michigan state statute would be repealed from law. Because we know they're not an effective deterrent in being a deterrent for youth to use or to continue their use with tobacco.
Do you see this analogous to alcohol, minor in possession?
I'm not an expert in the area of alcohol, but I can say of decades worth of work on this issue that tobacco laws that are inequitably enforced on our youth do not show a decrease in use amongst our kids. And that's not only true here in Michigan, but nationwide.
All right, but both peer and parental influence takes an effect on the adolescent at that point so that they begin smoking. Is that true?
Kids initiate, average age of 12, 13, 14. They initiate for a variety of reasons, flavored tobacco being one of the predominant reasons why kids begin using. But it varies depending on the youth who begins to experiment or initiate.
And I believe that we have parental penalties for parents supplying children with alcohol. And I have a feeling that if we let children off on this, they're going to take advantage of it. And I would rather see some type of penalty, not criminal, but some type of penalty come into effect. Thank you.
Madam Chair, if I may add. We license alcohol in the state of Michigan. If you want to sell alcohol, there's a standard set for those who want to sell liquor, and there are processes in place to hold them accountable if they are knowingly selling to minors. The problem with tobacco is it's the wild, wild west. There is no regulation, there's no standards. So I think the first step in beginning to address the accountability piece is to start with those that are actually distributing tobacco and selling tobacco, and simply allowing the licensure program to open up the door for us to keep track of who is selling and what they're selling, so that we can sift out the bad actors and then talk about what are other ways we can have deterrents for children.
I appreciate your point, Rep. Hayash. I do believe that the, the retail and the supplier, the seller, should be penalized if they are selling to a minor. My concern is the minor is going to take advantage of it if there's no penalty for them. You know, they're just going to go out and try it. That was my point. But thank you.
Representative Johnson.
Thank you, Madam Chair. Thank you for your concern for our young ones. We all share this, I'm sure. As just a point of clarification, wouldn't you agree, though, whether there's licensure or not, we have regulation, we have disciplinary action, and there's prosecution either way. They shouldn't be selling to someone who's underage and in certain parameters. So I think sometimes we just get so hyped up on the licenses. I don't know why someone needs it to sell a Christmas tree. I don't know why they need it to do a lot of things. I'd rather see better prosecution, better limits, better enforcement than just more licenses across the board. Do you have any comment on that?
One of my members was in charge of looking at an area just north of here, and she would come back in fits because there was no centralized list. She would literally have to drive around the county. Oh, we can turn that on. Sorry about that. She would have to drive around the county looking for retailers. And if she missed them because it's in the back of a game store that she doesn't think to look in, she would never know about it. She then submits that list to the state, who maintains sort of a centralized database, but it doesn't exist. And the retailers, they know they're not going to get checked very often at all, right, currently. Under this program, they would be licensed, they would be subject to regular checks, and they would potentially lose their license, at which point they would no longer be paying a very small fee for failing the one check they get every decade, and they would actually risk losing their license, and that has been shown to reduce the sales to kids.
Okay, thank you for that. We have one more question, and then we need to move on. We're running out of time. We all know that we have session, but we need to hear from our medical team. And so with that, Representative Arbit.
Thank you, Madam Chair. Thank you so much for being here. And kind of a little bit going off Rep. Johnson's point, I am concerned a little bit about the burden on small businesses and retailers. And I'm wondering a couple of things. One, if there has been any thought to potentially also building in another incentive to compliance by either reducing the fee for the next year if they're in compliance for a year, or refunding part of the fee, or even potentially providing, again, based on compliance, potentially a longer time horizon for the duration of a license, or sort of building out some sort of incentive structure beyond just a fine for non-compliance, potentially to sort of ease the concerns of certain stakeholders, and for those who, if you have nothing to hide, if you're not misbehaving, you should have nothing to fear, right? Sort of kind of building that into the structure here.
Representative, in order to hold tobacco retailers accountable and be able to actually run a process where you're checking up on if they're in compliance, that requires funding. And this is the mechanism in which it will move towards funding that program, so it's not a burden on customers. And I'll say it's cheaper than their internet bills that they would be paying for this program. So I think it's a relatively insignificant fine, $500 annually. If you try to reduce it year over year, at what point do you get nothing out of it? This is more so that the state has adequate resources to be able to, again, establish a program, because this is an unregulated, if you go to a smoke shop right now or a gas station, there are literally vapes that are being sold right now that are not approved by any agency in the entire country. So there are illegal devices being sold that young kids unfortunately go in right now and sneak them into their pockets in schools, and they're vaping all morning because they're able to hide it because it looks like a highlighter, or it looks like an eraser or a pencil. This is a serious problem. And it is something that has to be addressed. And the step one is to actually figure out who's out there, who's selling, and what are they selling, so we can build out a program to hold folks accountable.
Thank you.
All right, thank you all. Thank you so much for your testimony. Thank you for joining them, Representative Ayash. With that, we are really running out of time. So this is what I want to do, because I want to be fair. Jerry Griffin, is Jerry Griffin still here? Oh, there he is. Jerry Griffin's with Midwest Independent Realtors. You are here to speak in opposition of the bills.
Yes, I am. Thanks, Madam Chair. And being mindful of the time constraints, I will be as quick as possible. MIR is a multi-state trade association representing thousands of small family-owned businesses engaged in the entirety of the supply chain in the food, beverage, petroleum, and amongst other industries. And certainly while we understand and endorse the desire to combat teen smoking, we cannot support these bills as they simply don't do anything in succeeding to that goal. House Bill 6002, in creating a license with a substantial fee, would now have our members having to get a license to sell a product that they've been selling legally for decades. And I can't honestly picture how us having a license would somehow combat teen smoking, what the connection is. If the idea is that by having us get a license, the state can now identify all those that are selling tobacco, we already have to do that. When we get our state sales tax license, we have to check if we intend to sell tobacco. So that list should exist. There should be a way to pull all that information together. And if this fee is necessary for enforcement, I would remind members of the committee that tobacco sales generate about $700 million in tax revenue annually. The fee created in this bill would generate about $6 million. So all we need to do is redirect 0.9% of the tax revenue that's currently generated towards the $6 million that we've generated by this bill for enforcement purposes. And let me say this. The bad actors who disregard the law, they absolutely should be punished. They paint a broad brush for all of us. All of our retailers are out there. We're not in the business to sell tobacco to kids, but there are people out there who are in that business and who are interested in doing so. Those people aren't going to get a license anyway. They're still going to find a way to find that customer base, for lack of a better word. They're still going to find a way to do that, but they're just not operating in a storefront. Those people are not going to have a license. They're not going to pay the taxes on those cigarettes. They're not going to check your ID. They only want to make sure you have money in your pocket, and this bill doesn't address that. We've heard testimony on bills like these related to particularly the problems in the city of Detroit, and that the city of Detroit was referred to as a tobacco swamp. And then we just heard testimony about 60% of sales to minors or something to that effect in the city of Detroit. I would remind you right now, the city of Detroit has a licensing ordinance in place. So if you want to sell tobacco in the city of Detroit, you have to have a license. So that already exists. So secondly, House Bill 6022, which would allow local units to create their own patchwork of regulations regarding the sale of tobacco products within their boundaries. Simply a recipe for chaos. It would create winners and losers. A store owner in a community who has invested in that community and had that store for years, that community suddenly decides to opt out of tobacco sales. That owner does not just lose the sale of the tobacco. Tobacco sales on average are part of a transaction where additionally 5 more products are sold. The revenue from those sales are gone as well. And this will threaten the viability of many of these small businesses. Those sales will simply go to retailers in the neighboring community. People want the product, they're going to get the product. And with the proliferation of delivery services that we now have, the winners are going to be those stores that are right in the neighboring community that have decided to allow people to choose to smoke tobacco or not. The other scenario, the nightmare scenario in allowing local units to do this, is you could have a continuously on-off as new members are elected to city councils, township boards, and so forth. They might suddenly decide to ban tobacco in their community. Then 10 years later, they decide to allow it because new members come on. And then 5 years later, they decide to ban it again. It just creates an absolute chaos for people who have made an investment in those communities. Also, there's nothing speaking here as to if any of this can be applied retroactively. I would bring to your attention that this very issue on preemption was brought up in the state of Ohio last year. There are a number of communities now in court with the state of Ohio over this preemption issue. So we would hope that you would keep this as a state regulatory framework, and there are regulations at the state level that exist currently. But most importantly of all, these bills do nothing to combat teen smoking. Education is the key to informing and dissuading teens from smoking. Let's direct the sizable tax revenues that is already generated towards those types of programs. And any increase to retailers, we're going to pass it along to our customers. So anything we do that makes it more expensive is going to drive people towards finding those illicit legal sources out there. So I would simply ask that I would urge the committee to focus its efforts on proven methods that address teen smoking and not measures that have been tried in the past and are being used currently that simply don't work. Thank you for your time. And I'd be willing to answer any questions anyone has.
Thank you for your testimony. All right, I know we're out of time.
Thank you.
For the health experts, 5 minutes? 5 minutes. Come on up, please.
So I'd like to, my name's Dr. Taylor. I bought these at the gas station today, and they didn't card me, just want you to know.
Uh-oh.
Do you want to look at them?
So introduce yourselves, and then you can get into your show and tell, Doc.
I know.
I appreciate
I
you.
just wanted to make sure that I got my 5 minutes to talk about this stuff, and you guys could look at all of these and where it says that they're made on the back, but where the business is focused. It's in Michigan that makes these products, that sells these products. I'm Dr. Taylor. I work in Flint, Michigan. I am the co-chair of the Keep Michigan Kids Tobacco-Free Alliance. And so this is an issue everywhere. I'd like to talk about some of the things that were just brought up. So I work at Michigan State University in the Department of Public Health. My entire life and job has been devoted to showing and bringing forward evidence-based practices and policies. My boss and my mentor is Dr. Mona Hanna. Maybe you know her. She helps a lot to make sure that policies are equitable and that they work and that they make sense. Tobacco retail licensure is one of the most effective ways to deter youth uptake of any nicotine product. I don't know where we're getting our information from here, but there are multiple different studies. There was one published in 2019 in Pediatrics, another in the Journal of American Medical Science, and then also by the American Journal of Public Health just in the last year, and the last 5 years, that show that in areas that have tobacco retail licensure have a 50% decrease in the youth uptake of tobacco products. Just in a 6-month period, when they did this in a region in Pennsylvania, there was a 26% decrease in the number of youth that were accessing tobacco products. It is not a one-size-fits-all. It is one part of what we are doing. I'm here today with these two other wonderful ladies who do a lot of the education, and I do too. It's a huge part of it, but I need you to meet me in the middle to do this. I cannot keep combating this when they're just so easy to get there. To get their hands on these products, they smell great, they look great, they taste great. The tobacco industry spends $2.8 million a day pushing these products towards our kids. A $500 fee a year is too much. I get it. It is a privilege to sell this product. It is a carcinogen. It is the leading cause of death in Michigan, and it costs us $5.3 billion every year in healthcare expenditures. And we're arguing over a $500 fee? That is ridiculous. Ridiculous. And yeah, we can laugh in the back, but the tobacco retail licensure it works in 40 other states and 3 other districts. They have not been driving them out of business. We do not want mom and pop shops done. I just want them to not be in the hands of my kids. And I'm super happy to talk about at the next in the spring about moving some of those tax dollars into education, since our department is tied for last place in the amount of funding that the Michigan Department of Health and Human Services does for their funding that they should be putting forward for tobacco education. So I'd love to talk about that too. But tobacco retail licensure works. That is why we are talking about it today. That is why it is everywhere. And it is so crucial that we do this part so we can hold those people accountable that are selling to our kids these products. Right now, we really don't have a mechanism. It's all about the enforcement. We really don't have a way to do this. They just did a study, and this is my last thing, so I apologize, that the Michigan Department of Health and Human Services does a study every year with high schoolers, and 95% of them said, I went to buy a tobacco product in a store, and I was not denied because of my age. 95%. And they know that. They're aware of that. This is where they're getting their products. 30% of them are getting it from a retailer in the state of Michigan, and this was in the last year. 40% get it from somebody else, whether it's a friend or a family member, but you know that that friend is buying it from a retailer. Only 1 to 2% are getting it online. Tobacco retail licensure also has not been shown to drive black market sales as well. This is part of what the tobacco retail licensure does, is help to deter these sales as well. And I also want to emphasize that over the last year, that we have spent a considerable amount of time changing these bills to make sure that they would work for Michigan, that they're not just something that we've slapped on from another state. We've changed them significantly. So this has not just been the high and mighty public health officials want this and pay for it, et cetera. We've worked significantly hard to make sure that these bills are appropriate and are going to be effective and do what we want them to do here.
Breathe. Okay.
Sorry. This is like my life's passion, if you
No,
didn't
it
know.
is, and I feel that, and I appreciate that. We need advocates like you working on behalf of our young people. With that, I know, I wish we would have had more time, but it just is what it is. Grateful to have been back. We have a number of cards that we do not have time to read in, but the clerk, however, will be certain to enter them into the minutes. Oh, okay, do you want, okay, all right, you're gonna be the reason we late, Representative.
I will take full responsibility for everyone being late. What happened when you reported the gas station for not carding you?
So I do it. There's a system on MDHHS. I haven't heard back. I love the people at MDHHS in the tobacco section. So I never want to disparage them. I always want to emphasize the fact that they are super underfunded. You can go on. It's a little bit of an arduous process right now to do that. And then they eventually will go and send somebody to check it in, or some sort of local police officer to go
But
check
you
it in.
reported the gas station.
Yeah, every time I go. I buy from them. It's 5 for 5.
Wow.
Love it. My favorite deal.
Whew, again, a lot. And be certain on your way out to check out all the illegal things being done that are being sold that are hurting our kids. There being no further business before the Committee on Families, Children, and Seniors will now stand adjourned. Thank